McGraw Show on KTRS.
All right, Dr. Bradley Freeman is back. He is professor of surgery at Washington University. Good morning, Dr. Bradley Freeman.
Hey, good morning, McGraw.
I thought you were crazy a couple months ago when you're bringing up some weird mosquito-borne illness called Chikungunya, and it turns out it showed up here in St. Louis.
Well, we like to be on the cutting edge, and as the KTRS discerning listeners expect.
But that was it's interesting. I mean, how worried should we be about this thing?
Well, it is a mosquito-borne illness, and it is not fatal, but nonetheless, people can get quite ill from it in terms of fever and joint pain and that sort of thing. And certainly, there's a possibility that it would mimic or be confused with other illnesses. So I don't think it's, say, something serious like malaria, which can be fatal, or something like that's a self-limited illness, and people that do go to the hospital and require admission would respond to, if you will, supportive care, meaning not specific therapies. But I think it will probably result in some illness, and I think we have to be cautious about contact with mosquitoes and appropriate public health measures and that sort of thing. So I think it's something we're going to see, and I think it will certainly be a nuisance to a lot of people.
Yeah, and we should say that this person who was diagnosed with it was down in the Caribbean, right, and then came back here and sort of it sort of broke here, but he caught it down there.
Correct.
Right? Yeah.
Correct.
Yeah. All right, let's get to some other news here. Hepatitis C is now a state issue. What's going on here?
Well, this is a very interesting story, and it really speaks to medical innovation and the financial consequences of that. So hepatitis C is a very common cause of liver disease in the United States, and within the last several months, a new treatment for this condition has been approved by the Food and Drug Administration, and it's a very expensive treatment, such that several weeks of treatment, which is the standard course, costs roughly $84,000. And so as you can imagine, insurance companies and pharmacy benefit manufacturers are very concerned about this, as are budget people at the state level. And it turns out that a lot of people that have hepatitis C are on the Medicaid rolls or in the incarcerated population. And so, interestingly, a local company, Express Scripts, which is a major pharmacy benefits manager, did an analysis just to look at the potential financial burden of this across state governments. And it turns out, if you even just looked at Missouri, to treat the hepatitis C patients, again, on Medicaid or in an incarcerated setting, it would cost roughly $1 billion, $1 billion, which is huge, translates into approximately $173 per resident.
And you're talking just for the state of Missouri.
That's just the state of Missouri, so that's roughly 10% of the Medicaid budget just to treat this condition, and every state across the union will be confronted with this, and it will be interesting to see what decisions policymakers make with respect to who will be a candidate for this, and what trade-offs they'll make with respect to supporting other aspects of Medicaid funding. So it's on one hand, this is a good news story from the standpoint we have a very effective new treatment against a common disease. But on the other hand, all these innovations are very expensive, and how we, if you will, balance competing obligations will remain to be seen.
I'm going to ask a very silly question here, and I apologize for my ignorance. Hepatitis C is what? How do you get it, and what is it?
It's a good question. It's a virus. So a hepatitis is a virus, which is a germ, which infects the liver via the bloodstream. So it's transmitted, say, by body fluid contact. Several years ago, a test became available to allow us to test the blood supply. So it would be extremely, extremely unlikely, say, that you would get it from a blood transfusion, but say you might get it if you were an intravenous drug user and shared needles, or if you had unprotected intercourse with someone infected with this disease and that sort of thing. So I would say for individuals who are not infected and say get a blood transfusion, the risk of getting it is essentially nil, but there's other routes of transmission. And that somewhat explains why you see it a lot in relatively underprivileged populations, including people who are incarcerated.
Interesting. All right. Also, let's move on. We got actually, you know what, Doctor? We are out of time, but that's something to chew on there. Thank you very much, Doctor. Hope all's well. Have yourself a good week. Hope the summer's going well. Enjoy the good weather, and we'll talk to you next Wednesday.
Hey, have a great day.
Thank you, Dr. Bradley Freeman, professor of surgery at Washington University. They're saying that it could cost the entire federal government $55 billion to treat everybody with